Have you ever thought about how some, well, seemingly simple materials can actually hold the key to really profound advancements, especially in complex fields like medicine?
It's fascinating, isn't it?
Yeah. So today we're doing a deep dive into one of those hidden heroes, something you probably don't think about much, but it's genuinely shaping the future of healthcare. We're talking about hydrogels.
That's right. These materials, they act like incredibly sophisticated, almost microscopic sponges.
Sponges, yeah. And they're opening up all these new possibilities for medical and biological applications. Our insights today, they're drawn from a really comprehensive review in Designed Monomers and Polymers.
A great source.
It properly unpacks what these polymeric hydrogels are,
Right.
how scientists decode their properties, and, where they're being used in the biomedical field.
And that's our mission for this deep dive, really, to pull out the most important insights from that material. We're going to look at what hydrogels are, fundamentally.
Okay.
Then explore the, frankly, ingenious ways scientists study them, their properties, and then reveal where they're actually making a difference in healthcare now. Prepare for some real aha moments,
All
I
right,
think.
I'm ready. So let's start with the basics. The source defines a hydrogel as a cross-linked polymeric network. Now that sounds quite technical,
It does bit, yeah.
but you can think of it like an incredibly intricate sort of 3D molecular net, or maybe scaffolding.
Exactly. It's not just a random blob. It's a highly organized structure on a tiny scale. And what's truly remarkable is its superpower, this amazing ability to absorb and hold water.
And we're not talking just a little bit of water, are we?
No, not at all. Some hydrogels can soak up literally thousands of times their own dry weight in water. It's incredible.
Wow.
Well, this massive water holding capacity comes mainly from specific chemical groups within the polymer chains. We call them hydrophilic groups, things like amino, carboxyl, hydroxyl groups.
Water-loving groups.
Precisely. Think of them like tiny molecular magnets just pulling water into the network. And if you were to remove all that water, you'd be left with what's called a zero gel.
So zero gel is just the dry framework.
Just the dry network, yeah.
So if it's like a sponge, what makes one hydrogel absorb more water than another? The source mentions a couple of key factors, right?
It does. It really boils down to the design. First, the more of those water-loving hydrophilic groups you build in, the more water can hold. That makes intuitive sense.
Okay, more magnets, more water.
Pretty much. But here's the tricky part, the engineering challenge. If you increase the cross-linking density, imagine making that molecular net tighter, more connections.
You'd think it holds more, maybe?
Counterintuitively, it actually holds less water. And it also becomes more hydrophobic water repelling and, paradoxically, less flexible, more brittle.
Huh. So it's a real balancing act for scientists, trying to get just the right properties.
Absolutely. It's all about tuning that structure. And it's interesting, this isn't a brand new problem. We've been working with biomedical hydrogels for a while.
How long are we talking?
Well, the source points back to 1960. That's when Wycherley and Lim first developed cross-linked polyhydroxyethyl methacrylate, FEMA for short.
Right.
And that invention basically kicked off the whole field of modern biomedical hydrogels. So over 60 years of development.
Wow. And it's not just those synthetic polymers like FEMA or PMMA, polymethyl methacrylate.
No, not at all. Nature gives us some great starting points too. The review highlights biopolymers like alginate and chitosan. These are natural compounds, and they're really useful because they tend to be inherently biocompatible.
That makes sense. Use what the body might already recognize.
Exactly. Now, when we classify these hydrogels, there are a couple of useful ways to think about them. First, how they're formed. You've got permanent hydrogels.
Okay.
These are built with strong, stable, covalent bonds. Think PMAA, FEMA. They're locked together.
Permanent links.
Then you have physical hydrogels. These rely on weaker, more dynamic interactions. Things like molecules just getting tangled up, ionic attractions, or hydrogen bonds.
So more like temporary connections.
Sort of, yeah. Like molecular Velcro, almost. Examples would be polyvinyl alcohol, glycine hydrogels, gelatin gels, like in Jell-O, or even agar-agar gels.
Okay, so permanent versus physical. What's the other way to classify them?
By their responsiveness. So conventional hydrogels are pretty straightforward. They soak up water, but they don't really change much based on what's around them.
Okay, stable sponges.
Right. But then you get the really interesting ones. Stimuli-responsive hydrogels. This is where the clever engineering comes in. They're designed to actually change their swelling behavior, how much water they hold, based on shifts in their environment. like changes in pH or temperature or even electric fields.
Whoa. Okay, so they react. Give me some examples.
Sure. So pH-sensitive ones are already used in pharma. You could have a hydrogel coating on a pill to protect your stomach lining from something harsh like aspirin. Or it could protect a drug that's sensitive to stomach acid, like penicillin G, ensuring it reaches the intestines intact. They're also being looked at for things like blood glucose sensing and smart insulin delivery systems.
Smart insulin delivery, that's huge.
It really is. Then you have temperature-sensitive ones, used a lot in tissue culture to control cell environments, and electric field-sensitive ones are being explored for things like artificial muscles or really precise on-demand drug delivery.
Artificial muscles. Amazing. So we have these incredibly smart, responsive materials, but how do scientists actually figure out how they work or, how to make them do these specific things?
Yeah, that's crucial. It comes down to characterization. That's the scientific toolkit we use to really understand these materials inside and out.
Okay, characterization. What's involved?
Well, one of the absolute basics is measuring the percentage swelling. You need to know exactly how much water a hydrogel can take up.
Right, the sponge capacity.
Exactly. And it's calculated pretty simply. You weigh the swollen gel, subtract the dry weight, divide by the dry weight, and multiply by 100. Generally, higher swelling often means things like drugs can move through more easily, higher solute diffusion. But it's complex.
So knowing how much water it holds leads to the next question. How do things actually move through it, like drugs or nutrients?
Precisely. That's about diffusion properties. Scientists use principles like Fick's equation to model this. Experimentally, they often use something called a double-cell diffusion apparatus.
Okay, what's that?
It's basically two chambers, a donor chamber with a substance and a receptor chamber, separated by the hydrogel membrane itself. It lets them measure diffusion coefficients accurately.
And what affects how easily things move through?
Several things. One is tortuosity. Basically, the pores inside aren't straight tunnels, they're winding paths, like a maze.
Makes it harder to get through.
Definitely. The nature of the crosslinker matters, too. You can tailor things like peg chains to make it more or less water-loving. Ionic interactions between, say, a drug and the polymer can play a big role. And even the polymer's overall molecular weight influences diffusion. It's a lot of factors.
Okay. Now, before any of this gets near a patient, safety has to be paramount, right? Biocompatibility.
Absolutely non-negotiable. The good news is hydrogels are generally considered very biocompatible and non-irritant.
Why is that?
Well, think about it. Their hydrophilic, water-loving nature means any leftover toxic chemicals from making them can usually wash away easily. Plus, all that water makes them soft and rubbery.
Less friction against tissues.
Exactly. It reduces irritation when they're in contact with delicate biological systems. So scientists start with in vitro tests, lab tests.
Okay.
They might put the hydrogel directly in contact with cells, or they test leachates, anything that might seep out of the material over time.
How do they know if the cells are okay?
They measure things like cell viability and proliferation. Are the cells alive? Are they growing? A common method is the MTT assay. It's colorimetric, so if the cells are alive and metabolically active, they turn a purple color.
Visual confirmation. Neat. What about how liquids, like blood, interact with the surface itself?
Good question. That relates to wettability. How well does a liquid spread on the surface? If a material has a small contact angle with blood, meaning the blood spreads out easily instead of beating up, that generally indicates good blood compatibility.
Okay, less likely to cause clots.
Right. And similarly, higher surface hydrophilicity usually means better cell attachment, which is really important for applications like tissue engineering scaffolds where you want cells to stick and grow.
Makes sense.
And this is crucial while these in vitro lab tests give us really valuable information.
There's a but.
There's a but. For regulatory approval for actual human use, rigorous in vivo tests in living animals are absolutely required. You have to show it's safe in a whole biological system.
What kind of animals?
Depends on the application. Maybe calves for cardiovascular devices, or baboons or rhesus monkeys, because their biological systems, especially blood, are quite similar to humans.
Okay, so safety testing is rigorous. What other properties do scientists need to nail down? You mentioned wound dressings earlier.
Yes, for wound dressings, the water vapor transmission rate, or WVTR, is critical. It measures how much moisture can escape through the dressing.
And you want that to be low?
Generally, yes, for moist wound healing. A lower WVTR means the dressing holds moisture in, which helps wounds heal faster. The source notes that a good moisture-retentive dressing has a WVTR below 35 grams per square meter per hour.
Okay. And what about strength, if you're placing a ligament or something?
Mechanical properties.
Yeah.
Absolutely vital. Think about it. If a hydrogel is going to be an implant, it needs to withstand the forces inside the body. The FDA has guidelines for this.
Right.
But here's that trade-off again. Increase the cross-linking to make it stronger.
And it gets more brittle.
Exactly. So the goal is always finding that optimum degree of cross-linking, the sweet spot that gives you enough strength and enough flexibility for the job.
How do they actually check what chemicals are in there or the structure?
Ah, good point. They use analytical techniques. Infrared spectroscopy, or IR, is like a chemical fingerprint. It identifies specific functional groups, like the OH or CO bonds, that are crucial for holding water.
Okay.
X-ray diffraction, XRD, helps understand the crystalline structure. Is it ordered or amorphous? That affects mechanical properties and water uptake too.
And what about how they behave under stress, how they flow or deform?
That's where rheological analysis comes in. If you connect this to the bigger picture, rheology is all about understanding how materials flow and deform under force.
Right.
It helps determine things like the polymer's molecular weight, or tells you if you have an uncross-linked goo versus a highly cross-linked solid-like gel. They measure things called the storage modulus, G prime, and the loss modulus, G double prime.
G prime and G double prime.
Yeah. Think of G prime as the bounce back, how much energy it stores like a solid. G double prime is about energy loss, how much it flows like a liquid. For a really strong, highly cross-linked hydrogel, both G and G will be very high and run parallel on a graph. That tells you it's very stiff, very solid-like.
Got it. Stiff and solid.
And finally, even the surface texture matters, right down to the nanoscale.
Really?
Absolutely. Techniques like atomic force microscopy, AFM, or optical profilers like VSI let scientists actually visualize the surface topography. They can see the building blocks, the pores, and these can change quite dramatically when a dry zero-gel gets hydrated. That surface detail influences how cells interact with it.
Wow. It's incredibly detailed, the level of analysis.
Yeah.
So with all this understanding, all of these ways to characterize them, where are hydrogels actually being used? Let's get to the applications.
Right, the payoff. Well, one of the biggest and longest-standing uses is in controlled drug delivery systems.
Makes sense, given their properties.
Exactly. The basic idea is elegant. Water seeps into the hydrogel, dissolves the drug that's trapped inside, and then that dissolved drug slowly diffuses out into the body over time.
A controlled release.
Precisely. There are two main ways they set this up. First is the reservoir system. Imagine a tiny pill, like a core containing the concentrated drug, completely surrounded by a hydrogel membrane.
Okay, drug in the middle, hydrogel shell.
Yep. And the beauty of this is it's designed to release the drug at a constant rate, what we call zero-order release, like a steady drip. This works as long as there's still solid drug in the core.
Constant delivery, that's useful.
Very. Once the solid drug is gone, the release rate changes and starts to depend on the remaining concentration that's first-order release, where it gradually slows down. These systems are used for oral drugs, eye treatments, uterine implants, even transdermal patches.
Okay, so reservoir is one type. What's the other?
The matrix system. In this case, the drug isn't in a central core. It's uniformly dispersed throughout the hydrogel network itself.
Mixed all the way through.
Exactly. So the release depends on water diffusing in, hydrating the matrix, dissolving the drug locally, and then the drug diffusing out. It's a different release profile, often diffusion controlled from the start.
And you mentioned those smart hydrogels earlier.
Yes. This is where it gets really sophisticated. You can have chemically controlled systems. Maybe the matrix itself slowly erodes, releasing the drug. Or you can use those environment-sensitive hydrogels we talked about.
The ones that react to pH or temperature?
Right. Imagine a hydrogel designed to release more drug when a fever spikes, or only release its payload in the specific pH environment of the small intestine. Highly targeted therapy.
That's incredible potential. And the delivery routes are so varied, too. Oral delivery seems obvious, cheap, easy for patients.
Definitely. And you can do clever things there. Bioadhesive hydrogels can stick around for localized treatment, like in the mouth for periodontal disease.
Ah, makes sense.
Or they can be used, like we said, to protect the stomach from harsh drugs like ibuprofen, or protect sensitive drugs like penicillin G from the stomach acid.
Right.
The source even mentioned things like alginate Pitocin microparticles being explored for oral insulin delivery. That's a huge goal. Or using specific cationic hydrogels to target Helicobacter pylori infections right in the stomach.
Amazing adaptability.
Yeah.
And what about through the skin? Transdermal.
Yeah, transdermal is really attractive. Your skin is a massive surface area. A key benefit is bypassing first-pass metabolism.
What's that again?
That's when orally taken drugs go through the liver first, and the liver can break down a lot of the drug before it even gets into your main circulation.
Ah, so less drug actually works.
Exactly. Transdermal avoids that. So drugs like nitroglycerin for heart conditions or hydrocortisone for inflammation can be delivered steadily over long periods. Plus, hydrogel patches are often soothing, much nicer than greasy ointments.
Is it hard to get drugs through the skin barrier, though?
It can be, yes. Skin is designed to keep things out,
Mhm.
but researchers are finding ways. Using electrical force that's called iontophoresis helps push charged drugs like nicotine or certain antibiotics through, or using ultrasound sonophoresis to temporarily make the skin more permeable for larger molecules like insulin or vasopressin.
Clever workarounds. What about eyes and ears?
For eyes, forget gritty ointments. There are in situ gelling systems. They start as a liquid drop, so they're easy to apply.
Like normal eye drops.
Right. But once in the eye, they react to the temperature, or pH, and form a gel depot. This holds the drug there much longer, improving treatment.
Smart. And ears.
The source mentions local delivery of a growth factor, RSHI-GF1, using a gelatin hydrogel to potentially treat noise-induced hearing loss, delivering it right where it's needed.
And implantable systems, too. Things left inside the body.
Yes, and often here, biodegradable matrices are key. You want the system to deliver the drug slowly over time and then just dissolve away safely.
No need for removal surgery.
Exactly. The example given is a polycapridactone PEG system that released clonazepam, an anti-seizure drug, for 45 days before degrading. Very neat.
So drug delivery is huge, but you mentioned repairing and rebuilding the body, too.
Absolutely. Beyond drug delivery, hydrogels are making incredible strides there. Take wound healing. They've been used since the late 70s.
How do they help a wound heal?
Well, they act as a moist wound dressing. That's crucial. They absorb wound fluid, the exudate, and any bacteria, keeping the area clean.
Okay.
They also promote the growth of fibroblasts. Those are key cells for building new tissue. And keeping the wound moist allows keratinocytes, the skin cells, to migrate across the wound bed and close it up.
So creating the ideal healing environment.
Precisely. And here's a neat feature. Transparent hydrogels let doctors actually see the wound and monitor healing without removing the dressing.
Oh, that's smart. Less disturbance, less risk of infection.
Exactly. And some semi-inclusive hydrogels can even encourage angiogenesis, the growth of new blood vessels into the wound area, bringing vital oxygen and nutrients.
Really boosting the natural healing process. What about going beyond healing to actually building new tissue? Tissue engineering.
Yes, tissue engineering. This is a really exciting multidisciplinary field aiming to create biological substitutes for damaged tissues or organs.
Wow. How does that work?
The basic idea is often to take a patient's own cells and combine them with a scaffold material. And very often, that scaffold is a hydrogel. The hydrogel provides a temporary structure for the cells to grow on and form new tissue.
Like a template.
Exactly. But the scaffold design is critical. Pore size, for instance, needs to be big enough, the source says, generally greater than 80 micrometers.
Why that specific size?
It needs to be large enough for cells to migrate into it, for new blood vessels to grow in, angiogenesis again, and for nutrients to get in and waste products to get out.
Okay. Needs to support life.
Right. And this is where resorbable hydrogels are really important. Materials like PLA, PGA, PLGA, they're popular because they're relatively easy to process. You can tailor their properties.
And they disappear when done.
Exactly. They degrade naturally after the new tissue has formed and integrated, so you don't have a permanent implant left behind.
Clever. Any examples?
Sure. The review mentions things like collagen-coated inserts being used to make 3D corneal implants, PLGA foams used to culture breast epithelial cells, or collagen-coated scaffolds, providing a framework for liver cells, building complex tissues piece by piece.
Incredible potential. And you even mentioned gene delivery. That sounds like science fiction.
It does feel like the cutting edge, right? Traditional gene delivery often uses viruses to carry the genetic material, but that can sometimes trigger immune reactions or rarely cause mutations.
Okay, risks involved.
So researchers are heavily exploring non-viral methods, often using these biodegradable polymers, PLA, PLGA, PGA, again, as carriers for the genetic material instead.
Safer alternatives. Are they working?
We're seeing some really promising results in studies. For instance, specific PLGA PEG hydrogels help speed up wound healing in diabetic mice by delivering genes. That could be huge for diabetic ulcers.
Wow.
Another example, recombinant silk-elastin-like polymer hydrogels, SELP, increase the efficiency of gene delivery into human breast cancer cells, potentially making gene therapy more effective.
Targeting cancer genetically.
And one more, using alginate PLL, alginate or APA hydrogels to encapsulate cells. This protects the cells from the patient's immune system while they produce and deliver therapeutic gene products. In mice with tumors, this approach led to an 80% reduction in tumor volume.
An 80% reduction. That's significant.
It really highlights the potential for highly precise, targeted medicine using these materials.
So let's try and wrap this up. Bringing it all together, what's the big picture here for us? It seems like these hydrogels, starting as simple water molding networks, are incredibly versatile.
They really are.
They're not just inert materials, they're becoming sophisticated tools, medical devices almost, revolutionizing drug delivery, womb care, even tissue regeneration.
Exactly. And if you connect this to the bigger picture, hydrogels are a perfect example of how understanding a material's fundamental property,
Like swelling, diffusion.
how it interacts with biology, how things move through it, how that deep understanding lets us design incredibly specific and powerful solutions for healthcare challenges. It's material science making a direct impact on human health.
So maybe the next time you hear about a medical breakthrough, you might pause and consider the hidden role of material science. Could it be that a super sponge engineered with incredible precision is actually the key to tackling some of our most complex and challenging diseases?
It's definitely something to think about. The potential is enormous.